Hello and welcome to this presentation about the rabies virus. My name is Christian Kerr and I will be your co-host along with Landon Duggal and Jenny Crummett. And yeah, let's get started here. So we know that in every kind of virus, um, there will either be a DNA genome or an RNA genome. There's never going to be both. In the case of the rabies virus, it's an RNA genome. It's actually a negative single strand of RNA, and that's what's used to replicate itself once it's entered the host. Because it is an RNA virus, we know that it won't go as far as the nucleus of the host cell. Instead, it'll only get about as far as the cytoplasm because that's as far as it needs to go. Because it's negative, it will need to convert itself into positive RNA, but once it's been converted into positive RNA, it can quickly be translated um, by the ribosomes, and they can then manufacture this virus and replicate it very, very quickly. Um, we know that the rabies virus is an enveloped virus. To refresh your memory, there are two kinds of viruses. There are naked viruses and there are enveloped viruses. Maybe kind of like a naked mole rat versus a hairy mole rat. We know that the naked viruses don't have anything beyond the capsid. That's kind of the final layer of protection. Um, However, enveloped viruses have an extra barrier, which is actually a part of the host membrane that it basically has stolen on its way out of the host, and then used and converted the special proteins that a virus needs um, are used in place of the proteins of the host cell. And in addition, they have these protruding spikes off of the envelope, which serve as a way to attach to the next host cell. As you can see in this diagram here, we have a naked virus on the left, and we have an enveloped virus on the right, which is the kind of virus we're talking about with the rabies virus. Um, the reservoir, or the primary habitat for the rabies virus, are mammals. Um, you can have the rabies virus in just about any mammal, but the most common carriers are bats, dogs, raccoons, badgers, and cats. Um, and it's interesting to note that depending on your geographical area, there tends to be a dominant animal that serves as the most common carrier. If you go to the East Coast, for example, raccoons are the dominant carrier of rabies, at least in the United States. If you go to the very southern tip of Texas, coyotes almost exclusively um, hold the territory for the rabies virus. Um, Foxes are the common carrier in parts of Alaska, parts of Texas, and parts of Arizona. And skunks actually serve as the biggest carrier up in the northern part of the United States, as you can see there on the map. Bats are common carriers throughout the continental United States, regardless of which state you're talking about. You can see that they're common throughout pretty much every state. So that ends my part of the presentation, and I will turn the time over to Landon Duggal, who will give you some more information. And we hope that you enjoy the presentation and learn lots. Good luck.
The first signs and symptoms of the rabies virus are a lot like the flu. You have your normal discomfort, your fever and headache, and a general weakness. And these symptoms usually last for a few days. Now there also may be other signs and symptoms, such as a discomfort or a prickling, or maybe an itching sensation on the bite location. And this progression will happen within a few days after that, and it can progress into cerebral dysfunction, anxiety, confusion, and agitation. As the progression continues, it may lead to delirium, abnormal behavior, hallucinations, and insomnia. Symptoms last between 2 and 10 days usually, and anyone who has started seeing signs without immediate treatment usually dies. Some more advanced symptoms are fear of water, difficulty swallowing, excessive salivation, and hallucinations. Rabies can also advance into two different levels of the disease. There are furious rabies, which the infected person is very excitable with erratic behavior. Someone who becomes very easily aggressive and violent and acts out. Or there are paralytic rabies. Now this takes longer to set in, but slowly a patient will go paralyzed and then slip into a coma and die. This is actually about 30% of what usually happens with rabies.
Largely responsible for transmission of rabies in Asia is the dog. Besides cats, monkeys, it must be noted that the saliva of a rabid animal is infective 2 to 3 days before signs of rabies appear in the animal. Clinical features. Rabies victims suffer horrifying symptoms and eventually die. Most pathetically, they know that the disease has no cure and they will die soon. The rabies victim dies a solitary death in isolation hospital ward, away from relatives, dear and near ones. The victim's hands are invariably tied to the cot by bandage or ropes. They are unable to drink even sips of water, undergo great pain and mental agony, and in most cases with full awareness. Prodromal phase. Tingling and numbness are experienced at the site of bite 2 to 3 days before clinical symptoms appear. Later, low-grade fever, headache and body ache are reported. Clinically, subsequently, patient develops painful spasm of the muscles that control breathing and swallowing, resulting in drooling of saliva, and person cannot swallow and voice may get hoarse. The pupils may get dilated. Tears and perspiration increases. Blood pressure becomes low. Patient develops hydrophobia, fear of water. Photophobia, fear of light. Aerophobia, fear of breeze. Later, as the disease progresses, patient gets agitated, combative and destructive. Shows mental confusion, becomes sensitive to touch, noise and light, gets extremely thirsty but unable to drink because of painful spasms in the throat, develops dehydration, loss of muscle tone and listlessness is seen in majority, and eventually death occurs in 3 to 5 days due to respiratory paralysis or cardiac arrest. Paralytic rabies is seen in about 20% of rabies cases. Here also, initially, the patient experiences tingling and numbness at the site of bite 2 to 3 days before the clinical symptoms appear. The paralytic type of rabies is seen usually in patients who had taken some anti-rabies vaccination in the past.
Now, the transmission for the rabies virus is actually fairly simple. It enters through any scratch, abrasion, open wound, mucous membrane, any way that it can really touch your blood or get into the mucous membrane, basically into your system. Now, this usually happens from an infected mammal, as we've covered, such as skunks, raccoons, fox, and coyotes.
There are 3 common procedures to follow if you are bitten. The first is if you are bitten by an unknown animal, assume it's rabid and get the shots. Second, if you are bitten by a pet or a farm animal, it will need to be observed for 10 days in quarantine for signs of the virus. If the animal remains healthy, shots will be unnecessary. And third, if bitten by a wild animal, it will need to be caught and killed, so a test called the direct fluorescent antibody test can be performed on its brain. This test looks for the signs of the virus antigens in the brain tissue, and if they are present, you will need to get the shots. Now, prevention for pets is important too. Make sure the animals around you are current with their rabies shots, and call your local animal control if you see ill or stray animals in your neighborhood, as they are more likely to carry the virus. To prevent rabies for yourself, avoid wild animals, particularly canids, bats, and rodents. Always closely supervise children with pets, especially dogs, and if bitten, go to the hospital immediately. The most common treatment for rabies is the post-exposure prophylaxis, and it is administered by cleaning the wound, first by running through clean water, second using an antiseptic, third leaving the wound open, and fourth going to the hospital. At the hospital, you will receive rabies immunoglobulin, and this works by providing pre-made antibodies to diffuse the virus and thwart spreading. This is the vaccine, and this vaccine should be given in any suspected rabies case. If the patient has never been vaccinated for rabies, they should receive 5 doses of the vaccine. The first dose is given at the beginning of treatment, and the next 4 are given at 3, 7, 14, and 30 days after beginning treatment. If a patient has been previously vaccinated, they will receive 2 doses, one at the beginning of treatment and the second 3 to 7 days later. These shots are administered in the shoulder muscles, and they are very expensive. A series of these shots can cost anywhere from $2,000 to $7,000. Here we have 3 examples of vaccines. The first is the human diploid cell vaccine, and it's created by using samples of human cells. The second is the purified chick embryo cell rabies vaccine, created from chicken embryos. The third is the nerve tissue vaccine, created using nerve samples from animal brains. The World Health Organization recommends the HDCV, or the human diploid cell vaccine, for human use, and it strongly discourages the use of the nerve tissue vaccine because it has the most severe reactions. Here are some extra facts about rabies. Rabies are most common in undeveloped continents. Asia and Africa have more rabies-related deaths than anywhere else in the world. Most rabies are contracted to humans through domestic dogs, and if untreated, rabies is almost always fatal.